Hi, everyone. Heather here with the California After School Network for another one of our Fireside Chats. We are actually at Fireside Chat number 20. I'm here with Michael Funk from the California Department of Education, Expanded Learning Division. And today we are very excited to be joined by Mariana from the Bay Area Community Resource Center. And so we're going to jump into some great conversation with her in a few minutes. But Michael, as always, we usually start with some policy updates, and I know you have a few updates for the field, so I'll turn it over to you to start us off.
Thanks, Heather, and welcome, Mariana. I've known you for a long time in our mutual work in the Bay Area, so glad to be on the Fireside Chat with you. So we had a week last week. We were actually scheduled to do the Fireside Chat, and right around the election, Heather and I just decided there's just too much noise, too much going on, too much confusion, upheaval, that the message would just get lost in the noise. And so we've pushed it back. But let's just look back and acknowledge it's still a time of great disruption and unsettledness. And I am not going to offer commentary on the election today, except to note that all across California, there's a lot of unsettledness. And the massive increase in COVID infections across the state is amplifying that exponentially in terms of programs like yours, if you're watching, who were thinking like a month ago that the talk was about reopening, and what's maybe after Thanksgiving we'll start to do a hybrid and these types of things, and some programs went ahead and opened, and some counties have gone from orange all the way to purple, skipped 2 tiers in the same period of time. So with that, I just want to say that not only affects our families and our children, but it affects all of you, and all of you who are trying to make plans and provide programs. And we want to be, as much as we can, a support to you. The phones have gone a little bit quiet. There's less email. I'm not inviting more email, but I just know that if things come up and there's ways that we can support you and talk you through, we have staff in every geographic area of the state, and we're here to listen, we're here to support, and we want to be here to help provide as much stability as we can. And one of the things that I keep encountering, in fact, we just, before we turned on the record button, Mariana and Heather were talking, and there was another example of some information that's out there that's not accurate, and it's causing some policy decisions and some confusion. And so again, we're going to provide as much clarity as we can. We're going to talk a little bit today about waivers for those programs that are serving school-age children of critical infrastructure workers more than 30 hours per week, or if the program is open more than 60 hours. You've heard us talk about this on the Fireside Chat. In September 4th, Department of Social Services issued a program information notice. The acronym is PIN, P-I-N, PIN number 2022, which gave the guidance on what guidance programs would need to follow to apply for a waiver if they are serving children more than 30 hours a week or open more than 60. And there was some provisions in that requirement that were very problematic for some programs and districts. One of them was the requirement of a higher level of criminal background clearance, which was, there's a different criminal background clearance if you're in licensed childcare. And the Department of Social Services Community Care Licensing was asking for that, understandably. But in several weeks of dialogue with them and further explaining how our expanded learning staff have the same clearance as any school district employee, and it is sufficient if it's 30 hours a week or less. So is there a way we can keep that same level of clearance if they acquire a waiver for over that much time? And of course, on October 18th, we posted guidance on the expanded learning page on our website, which does just that. And this is language that we actually wrote and developed and submitted to Department of Social Services. But it clearly states that the elevated background clearance that's part of the California Health and Safety Code does not apply to an employee of a school district or subcontractor, a county office of education or subcontractor, or community college district or subcontractor. And that was a big win. Of course, they're requiring if someone falls out of clearance because of some event, then you're required to report that to the community care licensing, which, but even with that, I've heard some examples of some confusion. So what constitutes 30 hours? That's one question. The question came from the field. So if our expanded learning staff are in some way supporting a student while they're doing things that count towards instructional minutes, do those hours count toward the 30 hours? There's some cases where they were actually in a hybrid situation, supporting children while the children were in distance learning, but they were counting that towards the 30 hours. So the clarity I want to make sure we understand is anytime a child is doing something that counts towards instructional minutes, they are in school. And so if a staff person is being supported by ACES dollars or the ACES program is there during that time, they are technically supporting the child during school, not the ACES program. So once the instructional minutes is done, then you start counting towards 30 hours. Another question came up, well, we have different sources of funding because our ACES funding doesn't allow us to operate for 30 hours. So what if we do 3 hours in the morning with the ACES funds, and then we do X amount of hours using some other source of funding from the district? And we actually will just count it like as if it's two programs. And the problem with that is that's not the spirit of the intent with community care licensing and Department of Social Services. We understand creativity and logic, but listen, folks, if it's the same child with the same staff in the same setting, it is the same program. And we can't let our accountants determine when a program starts and stops or what's required for licensing. I want to be in good faith with community care licensing and the Department of Social Services. So to the extent we can, getting the waiver is not that complicated in my experience, not my experience, in my understanding of what some folks have gone through. In some cases, there have been hiccups and some misinformation. Like I said, we will help support you, walk you through it. We've got a commitment from the State Department of Social Services to help us rectify any discrepancies in local interpretation of what the guidance is. So with that, once again, we encourage you to bring situations to our attention. We'll help you navigate them. If there's some confusion, we'll help you clear it up. To what end? To what end is to bring some stability to the children and families and some support to the children who are so desperately need it. What we know for sure is that there are children who are being harmed. I'm not saying that there's people intentionally harming them, but they're not doing well in this system. They're not doing well with distance learning, especially our children with special needs and English learners. They just desperately need the support. Children who, we understand that learning is social emotional. And so for a child to be behind a screen on a computer, let's say that the child doesn't read at grade level, they're at a severe disadvantage trying to navigate distance learning. So once again, as we've said all through this pandemic, if we're not doing all we can, we're part of the problem. We're contributing to children being harmed. And so I'll count on you to take this flexibility again and do all you can. And we're going to do all we can to support you in every way. So with that, I want to leave on a note of optimism. It looks like we've got some good news on the virus, and the beginning of the end of the situation looks like it might come as early as in December. I've seen news reports of up to $25 million or 25 million doses administered in December, with approximately 25 million doses a month after that. That's off the national media. So, you know, that can change within a matter of days, but it's still, what we can see is there's a path out of this, and stay patient. Don't get fatigued. Stay diligent. Let's stay on top of the support our children need. So with that, Heather, I'll turn it back to you.
Thanks, Michael. And, you know, as you all watching, if you run into issues with the waivers, folks telling you different rules or different things and what you've heard today, we encourage you to reach out to myself or Michael, and we can definitely help support and navigate as you're dealing with that, because it's not always simple. And so we're here to help and support as we can. But with that, I would like to change gears and have Mariana join us in this conversation. And why don't you start just a little bit talking about yourself, your organization, and kind of how you all started to pivot once COVID hit, and then we'll dig into some of your more recent exciting work.
Thank you, Heather, for inviting me and having me here today. And thank you, Michael, for clarifying and keeping us all in the same page. So yes, I'm Mariana Quintanilla. I work with Bay Area Community Resources. We are one of the largest nonprofits in the North Bay. We have more than 105 after-school programs in 7 different counties. And it's been a journey, right, to step up and make sure that we're serving the students and the families. So we have definitely seen the staff stepping up since March, driving with food deliveries, school supplies deliveries, tutoring virtually, and making phone calls to make sure the parents knew how to navigate the Chromebooks and the Google Classrooms and the Zoom links, and even providing in-person program in some of the counties.
That's great, Mariana. So I've heard, we've talked briefly, and I've heard from some others that your work is getting featured in some publications that are being written right now, and some because of the innovative and the very close partnership you've had with one district comes to mind, which is the West
San Rafael
School District. Yeah, can you tell us what's going on there?
Yes, absolutely. So in July, actually, we were approached by the district and said, hey, will you be willing to run an in-person summer program with ACES? We have the supplemental grant. And of course, let's do it. That required a lot of work. And the district coordinator of extended learning that time, Jennifer Lynch, she did an amazing job coordinating and working together with us on putting all the protocols in place. And it was a really new thing to do, right? The check-ins, the health screenings, the cohorts, the kids cannot share supplies, the PE equipment that we use per cohort have to get disinfected at the end of the day. So all those little details that make the program successful were well practiced in a 4-week program with about 100 students in elementary age. And we had the school teachers in the morning, and then the expanded learning staff taking over and doing enrichment for the other half of the day. And then when school started, there was a lot of uncertainty of what was allowed and what wasn't, and the cases spiking and not having a lot of data and information. And starting in September, with a lot of support from the Marin County Office of Education and the Health Department, the district, decided to open learning hubs. And it's been an amazing partnership. We operate at the school sites, 5 elementary schools, 1 middle school, and 3 high schools. And they're providing all the PPE. We work really close with the administration, with the enrollment process, with the support for the families, and aligning. It's been incredible to see the alignment piece, because alignment piece is a factor of quality programming for expanded learning. But now we are really providing access to learning for students that were not learning at home, for students that were not completing assignments. So without that alignment piece, then we're not doing it intentionally. And the purpose is really to provide equity in education, to bring these kids to where they deserve to be. And I think that's where being accomplished, but it has been definitely a big part of the partnership that we have with the district, and the seamless coordination, right? Like the BACR staff is part of the training with the school staff. The BACR staff is invited to meetings with the county health department. So it's been a seamless partnership.
It's very powerful. Very powerful. Now, just so there's not confusion, what color is Marin County right now?
I believe it's in orange, but I might be wrong, but I know that last week, so we already started the hybrid model. So we started with just learning hubs in September, and a week ago, actually, last week was the first week of the hybrid model. So right now we are providing expanded learning for the AM and PM cohorts, and we are also supporting, there's a 90 minutes transition where students that are not staying with us can go home, and then the other kids come and they do the asynchronized learning. So right now, starting last week, the county officials, health officials announced that students could have up to 3 cohorts. So we have the expanded learning cohort, and the teachers have the school cohort. And we, of course, take all the precautions and all the measures and guidance, and it's working, and it's really, it's really great. Give a lot of joy to see kids playing that they're airplanes or helicopters, so they don't touch each other and they keep their 6 feet distance.
Now, I want to clarify, that means a particular one child can be part of 3 different cohorts.
Right. And we only have them as part of 2 cohorts.
Yes. Okay.
And I know that has to go with the color. So I think that's what I think we'd probably just change to another tier, because they announced that it was 3 cohorts now.
Yeah. So, and for those that aren't sure or don't know, if you're in a purple, if your county's in the purple rating, which is uncontrolled spread, then there's very strict guidelines on a child can only be part of 1 cohort. That cohort can only have 16 humans, and there's all types of other restrictions and guidelines. And so I was just in a conversation before the Fireside Chat with a leader in Southern California, and was explaining that, the difference in the cohort guidance between purple and the other 3 colors. There's more guidance forthcoming. This provider information notice 2022 is going to be updated in a matter of days to bring more clarity, but it's basically what we just said. Purple tier, more restrictive. Move out of purple, you can have more flexibility and freedom. What's really important, though, is that the local county health person, the local county health department leadership makes those decisions. So what you're doing, Mariana, is such a great example of being at the table with the district, being part of those discussions, hearing firsthand. Well, we need some good stories. We need some good news. Tell us a little bit about the kids, the students, and the families, and what kind of support they're receiving and what that means to them.
Yes. So that's the best part, right? So to see many parents that say, thank you, I'm actually able to go back to work because my kids can be in school all day, or from 8 to 3, and not only for 3 hours. That is amazing. And to see the students that in some instances were not in the safest conditions in terms of the pandemic, right? Because they will have different babysitters, so they will have with many other kids or adults that are now in a content space where they are wearing a mask, where they're washing their hands constantly, where they're receiving a nutritious meal, where they're playing and they're exercising, and of course, where they're accessing learning. So we have seen the students is extremely happy. Funny story is from a colleague that was completing a health questionnaire last week, and some of the parents didn't complete the questionnaire. So we have the adults asking the kids, how are you feeling? Do you have a headache? Do you have a stomach ache? Do you have a runny nose? Are you coughing? How are you feeling? And this kid said, I'm feeling happy. And I mean, it wasn't exactly the answer, but it was the perfect answer, right? And I think that resumes, I mean, that summarizes how the kids are feeling in school. They're feeling happy, they're joyful, and they're eager to learn, and they're eager to learn in person. I think that is a priority.
That's a great story. Very powerful. Heather, I'm going to turn it back to you for your typical closeout.
Yeah. So we know, it's all over the place across the state in terms of whether programs have been serving in person or not, or whether they're doing learning hubs, whether they are doing hybrid models. So we always like to ask for those programs that maybe haven't started or have started but are still sorting it out, what is some good advice that you can give to the programs, especially considering how strongly you've partnered with the school districts, with the county health. Anything that you want to share with everybody else out there?
I think my biggest advice is to not be afraid to do what is right. I think we're right now in a moment where we really need to step up for the most vulnerable population. And I was faced by people like, really, are you going to open in person? Like, you're going to put your staff at risk, you're going to be at risk. And I was like, well, let's look at the data. Let's read what doctors are getting in other states or in other countries, and what really the transmission rate is among elementary kids, age kids. And of course, completely allowing the staff to decide if they wanted to come back in person, right? So that's something each organization have to assess and see how comfortable is their staff, and making sure that you have a strong agreement with the school district or whoever you're partnering with, to have all the PPE, all the disinfectation, the cleaning schedule has to be really clear and really structured, right? And enough training for the staff. If you needed 3 days of training before starting a summer program, for example, you now are going to need 6, because it requires a lot of planning, and if you want to have a high quality program, right? A lot of planning on activities that are going to be COVID friendly, and they're going to promote social emotional learning. That, and again, a step up without fear. I mean, take the risk, because some of the students and the families we're helping have no one taking a risk for them. So I think that's when we are playing such an important role right now.
Wonderful. Well, Mariana, thank you for joining us, but also just thank you for your commitment and for, pursuing the right thing for these kids every single day and their families. We appreciate it. I know they appreciate it. So thank you again for joining us today, and all your good work out in Marin. And Michael, I will turn it over to you to close this out.
Yes, thank you, Mariana. Thank you, Heather, for hosting again. We will have one more probably in December. Then we'll be taking a couple of weeks on a break, but we're planning a full year in 2021. It's going to be a full year, and we'll be here. And so stay tuned. Mariana, I really enjoyed the partnership with BACR, the Bay Area Community Resources, when I was the founder and director of the Sunset Neighborhood Beacon Center in San Francisco, and we were part of your AmeriCorps cohort, and just had a beautiful partnership together. Yep. And your CEO, Marty Weinstein, dear friend, we call him the OG of the expanded learning world. Tell him I haven't had a phone call from him in a long time, and I'll be looking out for something as I'm driving to Idaho. That's an inside joke. He'll get it.
Okay.
Okay. And so to everybody else, do the right thing. We support you. We love you. And lead with love. Let's serve our kids. Thanks, Heather. Bye.
Thank you. Stay safe.